Welcome everyone to today's webinar, which is about SPHN and BioMedIT information security policy. And I'm actually very happy here to have today experts from the technical side, but also from the legal side, who will actually provide you insights into this topic. Because again, I think if we look on these topics in isolation, actually it will not work. So it's really like an interdisciplinary endeavor. So with that, I would like to introduce the speaker of today. So we have Judit Blind, which is the legal officer for ethical, legal, and social implications here at SPHN, and as I say, our expert on all the legal topics. Then we have on the technical side Owen Appleton, who's the senior IT service manager. And also we have Shubham Kapoor, who's the lead of the BioMedIT Research IT Services. And unfortunately, Shubham cannot be here today, but I think it was very important for us to highlight because I think his contributions, because this is quite a lot of the work presented today actually is his credits. So also, if you have later questions and want to reach out, you can reach out to all three of them. And with that, I would actually hand over to Owen to dive into this very interesting topic.
Great. Thanks, Sabina. And hi, everyone. Nice to see you all. So some of these slides are from Shubham, including these introduction ones, and some I'll highlight later. So I'll answer as many questions as I can, but some we can always answer later on as well, after the event or in the Q&A. So just to give you a little bit of orientation for those that don't already know BioMedIT. BioMedIT is Switzerland's trusted research environment. This is a nationally funded platform which brings together institutions who provide infrastructure that allows us to do research using highly sensitive personal data. We have three nodes in our network, one at ETH, one at the University of Basel, and one in Lausanne, which together with central coordination from SPHN through SIB and the Swiss Academy of Medical Sciences, put together this BioMedIT platform. And this is supported through the Swiss Personalized Health Network and supported by SERI. It's been in production since 2018, so I think this is one of the more long-term trusted research environments within Europe. When we talk to people from other countries, they're surprised how long we've actually been processing data. And this really allows us to take data from universities, from hospitals, from research centers, and make it available in a safe way to research. We have something like 120 projects now that have been run on this infrastructure. Somewhere over 1,000 registered users, 35 data providing organizations onboarded, and a reasonable amount of technical resources, although often it's not about mass resources, it's really about the security here that we're talking about to be able to access this data. Also, I don't think these numbers represent the local use of these nodes as well as operating within a national context for national and multi-partner projects. They also support local use in Basel, in Lausanne, and in Zurich, which really represents a whole other usage layer as well. And if I really try and simplify our value proposition, it is a secure way to perform digital research on highly sensitive data. We harmonize and mobilize the data that comes from the data providing organizations. We provide a platform where it can be analyzed and processed, and we provide a way to securely receive results so we can really get economic benefit from the unique data sources we have in Switzerland. In terms of what we're going to talk about today, we've divided it into a number of sections. We're going to start with looking at why we have the approach we do to security. So this is the drivers of our security, the regulation underlying health data processing. This is what Judit will talk about in a moment. Then we'll talk a bit about the challenges we have, the policies that we use to address these challenges, how they're implemented, and what support we can provide. And hopefully this will either update you on what is our approach to security, because I think we've improved it in the last couple of years quite considerably, or introduce you to how we deal with issues of security around sensitive personal data. With that, I'll hand over to where it all starts and where we draw our inspiration and our requirements, which is from really the law and from drivers. And luckily, we have a real expert in this in Judit, who I will hand over to now.
Thank you, Owen. Hello, everybody. I would like to touch on the drivers, which, as Owen mentioned, is actually the applicable law. Next slide, please. The security measures for data protection are explicitly mentioned in different applicable laws. And those laws can be Swiss federal law, it can be cantonal law, or even partially even foreign laws, which can be applicable. But the good news I already want to share now is that all laws have several very similar requirements. Next slide, please. We're always talking about data protection, but we have to keep in mind that data protection is actually the protection of individual privacy, which is also set out in the Federal Constitution of the Swiss Confederation. So every person has the right to the protection of its data against misuse. Next slide, please. To protect this basic right of the data subjects, we have the Federal Data Protection Act. In Switzerland, we have 25 cantonal data protection laws, so that's only 25 because 2 cantons have joined forces, luckily. And there might be also some special laws to the data protection law, such as the Human Research Act, which I won't touch anymore here in this session. And also, depending on the setup of a research collaboration, you might have foreign law like GDPR or HIPAA or other laws. Next slide, please. Let's have a look at the multi-layered legal system in Switzerland. As mentioned before, we have the constitutional right of all data subjects, and those are secured once on the federal level and also on the cantonal level. So we have the Federal Data Protection Law, which applies if the federal government is dealing with your data, or private individuals or companies are processing data of natural persons. Then on the other hand, we have the cantonal laws, and they are applicable if cantonal, regional, or communal public authorities are processing data of natural persons, or partially also in some cantons, they are also covered for legal persons. Next slide, please. Here you have a quick overview, comparison between the 2 laws, the federal and the cantonal laws. As mentioned, the federal law applies for private individuals or private companies when they are treating data, or the federal authorities, whereas the cantonal laws apply if the cantonal or municipal public bodies are treating your data. So the question you have to ask yourself is it a private company or a private person that is processing the data? Then it's federal law. And if it's an official authority, then you have to see if it's on a federal or a cantonal level. If it's federal, again, it's the federal law. If it's cantonal, it's the cantonal law. You will probably know that a federal act has been revised on 1st of September 23, so it's quite a young law. And the cantonal laws are step by step adapting to the principles of the federal law. The harmonization is still work in progress, so there are many cantons that are not yet aligned. Then we have to have a look also at the enforcement of those laws. For the federal law, it's the Federal Data Protection and Information Commissioner, whereas for the cantonal laws, it's the authority of each canton. Next slide, please. As mentioned in the beginning, it might also be that you have foreign law that applies for a project for dealing with data. And that could happen if you are, for instance, processing data of EU citizens. Then it could be that GDPR could apply. However, it is very much dependent on the circumstances, how the data is collected, what you are exactly doing with the data, so it's very individual. One of the other foreign laws I would like to mention shortly is HIPAA. It is only applicable if US hospital or certain partners, insurances in the US are involved. And foreign law can always be applicable if you agree so in a contract with your partners which law could be applicable. In any event, I warmly suggest that you always consult your legal departments and your legal professionals who can have a very thorough look at the applicability of foreign law or also within Switzerland if it's cantonal or federal law. Next slide, please. The comparison only between those three laws, so the Swiss laws, the GDPR and HIPAA, the several technical and organizational measures, as well as the data protection principles, which are key, are mentioned in the Federal Act of Data Protection very explicitly in Article 6 and 7. As I mentioned before, the cantonal laws are adapting, they're catching up with the federal law, so there is not much difference. There might be some cantons that in some points are a little stricter, but in the basics, it's the same. Regarding patient rights, GDPR could be stricter. So again, please go to your legal professionals and see what you have to take into account. And regarding HIPAA, this is maybe the less strict of all mentioned laws, and it has a very limited applicability. Next slides, please. I want to touch quickly on the data protection principles, which have been mentioned before, which I said are already very clearly set out in the Federal Data Protection Act. So, first of all, it's the lawfulness. The principle of lawfulness, there you have to ask yourself, do you have a legal basis to process data under the applicable law, or do you have a consent of the data subject to do so? The principle of good faith, the question comes, could the data subject really expect the use of his data as you are using it? Or is it completely out of range? The same with the proportionality. Is every data point of an individual necessary that you are processing it? Do you need really everything? So we're also talking about data minimization here. The purpose limitation is very important. Is the use of the data compatible with the original purpose for which the data has been collected? And then the accuracy, is data correct and updated, because the individuals have the right of also rectification if something's wrong with the data. And also the transparency. How are you processing the data? Has this been explained to the data subjects? How transparent is it? And then we come to the key point, which is actually what is the topic today, data security. Are your technical and organizational measures risk appropriate? And with this very short overview, I would like to hand over to Owen again. Thank you.
Great. Let me just turn my camera back on. Okay, thanks, Judit. Thanks for that kind of background on where we get some of our requirements from. I'm now going to talk about the challenges we face in trying to implement this. And I think if I think about what's the sort of meta challenge in all of this, the law tells us some things we have to do and not do. It doesn't tell us how to do them. And particularly for processing sensitive personal data, there aren't a lot of standard ways to do this out in the market yet. For processing personal data, GDPR is widely implemented all over Europe, and something very similar is what we have in Switzerland. For moving into the idea of trusted research environments, this is a new enough area that we're really trying to break ground and come up with really one of the first structured solutions for this. There are other people in Europe doing it, but they're certainly not ahead of where we are. So we have to make an honest and ethical and practical guess or attempt at how to do this in a good way. And our priorities are certainly protecting the rights of the data subjects and those involved, exactly as you did said. So if we think about what are the security challenges we face, I think these are the five big ones for us. We have to respect data and data subjects. We, as the provider of this platform, often are not actually the one in sort of full control of this because we are often data processors. We're not controlling the data. Data is provided by, say, a hospital who has collected it from data subjects, and it's provided to a research group who are actually going to do the work on it. We're essentially assisting in that process. We're a data processor under one of those parties, normally under the research project. But we still really feel an ethical, moral, and practical and legal obligation to respect data and data subjects. But at the same time, we really need to balance usability and security to make sure that this data is usable for research. The sector we work in, it's not easy to always predict 3 years in advance when you write your project proposal exactly how you're going to process data. It's not like a very well-defined pipeline where you put in data type A and get out result B. There is a creative aspect to research which we have to support. So we need to look after the data, look after the rights of the data subjects, but also make our platform one that can actually be used for the way research is practically done. We also need to increase cohesion and facilitate federation. We are trying to bring data from lots of different organizations within Switzerland. We're trying to make the ways that we generate that data, harmonize that data through things like our RDF schema, which Sabina, who's our host here today, is really leading, and then make it available in these 3 sites, at least, maybe more in the future. In order to make it available to research, we need to get people to start to do things in the same way across different organizations, and this can be certainly challenging. We then need to do a lot of training and education with all parts of the community. We need the researchers to understand that it is riskier doing this in a remote way than it is in a secure site in a digital clean room or something like that. And we try and bring them benefits, but there are costs to that. For all parties, we can provide as many safeguards and rails as possible to make things secure, but we also need people to behave correctly. While we try and think about risks to data security from malicious intrusion, in fact, as often the risks are really about accidental bad action by people rather than someone from the outside trying to break in. So we really need to make sure everyone understands the part that they play in making sure that we can have secure access to this data. And through all of this, we try and create an elevated level of trust among the community who are dedicated to processing sensitive personal data in Switzerland for the healthcare sector. To try and address these challenges, we have a security concept, and this is a pretty high-level description. You'll see some of this on our website as well, but I think it gives you a pretty good idea. We operate in a federated way. We have multiple providers who work together to deliver harmonized services. We have quite high internal transparency within the federation. We have quite a high trust level within the federation, but it involves a lot of real detailed technical engagement. It's cost us a lot of time to get to this level. Thankfully, we've had good support through the Swiss Personalized Health Network from SERI over the last 8 years to get this built up. And we've discovered that because we're federated, we don't just really deal in technical controls that are the same everywhere. We're really policy driven. We define shared policies which operate across our federation. They operate for the data providers, they operate for the BioMedIT nodes, they operate for the researchers. We define what policies are global. We also define what policies everyone has to have locally. And we focus more on the outcome than the specific implementation because every organization has its own conditions, its own rules. We can't make it exactly the same everywhere, but we can try and make everyone run to the same rule set. Because we're also aware that none of this is absolute, we work in a risk-based way. We don't say that anything is ever 100% secure. This is just unrealistic, and I think it leads to complacency. So we try and understand what is the risk level, how can we minimize risks at all stages. We look at what are the vulnerabilities that we have internally and externally. We really also try and push the pseudonymization of data. SPHN provides some really good guidelines for this. And we try and understand what are the information assets we're trying to protect and how do we protect them. And then we support all of this with a set of agreements. We have agreements between the nodes in BioMedIT, we have agreements with data providers, we have agreements with research projects. We try and set out as clearly as possible to people what are their obligations, what is it they have to do based on these policies. Then we support this with a strong program of security awareness. Everyone that uses our service has to go through some very basic security training online. We can't guarantee everyone pays the most amount of attention to it. This is not realistic, but we expose everyone to the key pieces of information they need to know and try and make them aware of the risks in what they do and their place in providing security for this system overall. And that means that no one should ever be able to say that they weren't told or weren't warned that they have to take care with the data that they're providing or accessing and processing. And then lastly, we control access very tightly and we control transfer of data very tightly. We have probably the place we have most specific tooling is around data transfer between data providers and BioMedIT nodes and within the nodes. We provide specific technical solutions, but also we provide logging of all of this to make sure that we know who has moved data to where. This is all, as I said, also part of our security concept and architecture, which you can find on the BioMedIT website. In practice, what does this mean? We try and offer a kind of fairly holistic approach to providing security for BioMedIT. We perceive that there's different layers within providing this complicated set of trusted research environments. Infrastructure layer, which is really the metal, the basic virtualization on the bottom. Above this, there's a research platform layer, which includes a lot of the digital environments and tools that are available to everyone in the community. And then there's a whole load of researcher engagement that sits on the top. You could manage these as separate layers, but our feeling is, particularly for security, you really have to have coordination that crosses across all of these layers and that everyone really buys into. Otherwise, you open up the opportunity for there to be gaps between the layers that can be exploited or can lead to accidental disclosure of information. So as a kind of global set of coordination functions, this is where we look at the policies that span all of BioMedIT. We have working groups not just on security, but other topics like data harmonization and data standards, data management, the development of the tools we have, interoperability, all sorts. This is also where we have a global approach to coordination of the legal frameworks to support access to sensitive personal data. So we have a whole set of guidelines, we have a set of model contracts and agreements and information to help you make the agreements you need to use us and use our platform. If I zoom into what does this mean for security, and don't worry, I'm not going to go through this slide in detail. This gives you a little picture of what does it mean to try and break down this multi-level view on one topic. So here, security and privacy. We do different things at different layers. Down on the infrastructure layer, we're talking about having a secure basic setup of our virtualization environment, using infrastructure as a code, having physical infrastructure which is well protected. If we go up to the sort of research platform layer, this is where we're talking about tightly controlled data import and export. So having tooling and tracking that allows us to understand where data has gone, who sent it to where. And then really at the top layer on the researcher engagement, this is where we have to explain to people this balance of security and usability. We have to engage with them and understand their research process and see how we can support it. We have to provide training. We have to provide more direct support. And all of these things are coordinated on security through a security working group, which includes security officers from all of our nodes, and through a framework of security policies, and through the legal agreement framework provided by SPHN. So how do we then kind of try and start to implement that? I'm going to go on to some slides from my colleague Shubham. So these are focusing on the technical and organizational safeguards. We'll then see how they fit into the policies themselves after that. So in terms of safeguards, We have this policy framework, which I'll show you a little bit more of in a minute, which really tries to cover all of the topics from the federal data protection regulations, including classifying data, looking at vulnerabilities, reviewing our security, data retention, cryptography, etc. And we also do regular risk assessment. We do security audits, security reviews. We do assessments of new research projects as they come in to make sure that they operate in a secure way and that they're planned in a way that doesn't open up any unique vulnerabilities. Oh, I don't know why that jumped forward. We also have safeguards on encryption. We provide guidelines for how encryption has to be used within our system. We suggest certain ciphers, we suggest certain practices. Implementation can be slightly different across the sites, but all meets a basic level of requirement that we provide. We have a very tightly managed access control system with role-based access control, with a least privilege principle. So we really try and give people only access to the data they need, and we try and provide the data when they need it, rather than staging it in advance. We use multi-factor authentication for all of our systems. We also limit access to only coming from organizational networks. While you can access BioMedIT nodes remotely, you pretty much always will have to use your institutional VPN to at least help us reduce the attack surface and increase our security by adding the organizational security into that picture as well. We have, as I mentioned, a strong training and awareness program. So we have information security awareness training everyone has to take, as well as some role-specific training modules and support. We have a strong incident response approach. We have SOPs for data breaches. Luckily, we've avoided them up to now, and we have very clear responsibilities for who has to respond to incidents. And we have our own data classification schema, which we provide so that it can be mapped to whatever the individual organizations use. Everyone uses similar but not identical data and asset classification. We've come up with a risk-based approach, which is pretty easy to map to all of your local approaches and allows us to have at least a general understanding of classification of data across the whole net. Then, of course, we have more technical network security safeguards. We have advanced firewalls. We are protected against denial of service attacks. We have isolated VLANs for each project. Kind of the basics of network security for dealing with sensitive data. And we maintain records of processing activities in line with legislation. So we try and understand, what data is being processed, why, where's it stored, who has access, what security measures are in place. And together, this comes together in a sort of basic BioMedIT node architecture, which again, we make available online. This isn't secret, but it shows you the general structure of the technical architecture underlying our services. This is implemented by our 3 nodes in very similar but always slightly differing ways, depending on what technologies they've chosen. For instance, the remote access from some nodes uses slightly different remote desktop technology to others, because that's what those institutions have selected. But wherever possible, we try and drive harmonization in tooling and technology as well. We don't insist on it, but anytime we need any new technology, we're always trying to look for how can we all choose the same solution within our federation so that we can share knowledge, we can leverage our whole network's level of capabilities and capacities in order to make a better service. And we try and implement all of this or require this through our set of policies. We have a structure to our policies, which has come out over several years. We start with an overall information security policy. In early versions, this was really rather long, and I have to say the earliest versions, which some people here who are maybe from the hospital side will have seen, it was a mixture of a policy and a set of procedure documents. We'd probably spread a bit beyond what I would consider the policy level. We've restructured this now, so we have an overall global information security policy. Then underneath that, we have specific policies on topics where we need more data, we need more specific information, but it doesn't necessarily fit the global policy. And then we have standards, procedures, and guidelines on topics where we need additional help. And here, particularly the guidelines, these are not normative, these are not the way you have to do it, they're at least the suggested way that you might, for instance, fulfill this policy. So the top, these are required everywhere. This is the general policy. In the middle, we have the specific policies, but they're still required. The bottom is suggested or supportive most of the time. And if we look at what this looks like right now, so the current structure of our policy, we have the overall information security policy. We then have specific policies on data transfer, asset management, vulnerability management, security review, cryptography, container acceptance, incident coordination, and key management. All of these topics are covered by the overall general policy, but we go into more details in the specific policy. And then we have a growing number of these standards, procedures, and guidelines. For instance, under our data transfer policy, we have specific data about the mechanisms used by each of our nodes, because again, they all work slightly different technically. So this isn't really a standard or a policy. This is a place that we record for this node, you use this specific tool on this port, etc. The overall policy, which is the one that I think we're perhaps most interested in looking at today, has now reached version 4. So it's pretty advanced, and is broken down into various chunks. The first one is the requirements of the policy. This is what we agree we have to do. This is fairly detailed and technical. So here you'll see in a moment we have both a kind of description of an area and actual listed bulleted requirements. We try to make these as explicit as possible so that we can all understand them internally within BioMedIT, but also so that they can be understood by external parties as well, where we provide access. These also apply not only to the people providing BioMedIT, they also apply in some places to the data providers and to the research projects. We cover requirements on all of these groups. I'll show you that in a moment. We then have an annex to this, which is the security concept and architecture. This is essentially what I already presented to you. This is the challenges and our approach to it. This is why we do things, our general approach. What are the challenges? What's the context? This is intended to be more readable by a wider group of people. Quite often when people ask for having a look at our security policies, they don't want to see the detailed policy. They really want to understand our general approach. And this is perhaps more useful for that a lot of the time. And again, this is on our website. Sabina kindly already put it in the chat. So hopefully everyone can have a look at that and see that it matches what we presented. Now for our latest version, we've also started to include a filterable version of all of the requirements as an Excel sheet to allow assessment and filtering per stakeholder or per organization. The overall policy is basically a long PDF file, but because it includes these very specific bulleted requirements on the different stakeholders within BioMedIT, we found it useful to provide a filterable spreadsheet version as well. And I think this is just a very practical thing that assists in people understanding how and how they can fulfill these requirements and which requirements are on them. Because we have requirements that are on, for instance, research projects, this means that while we're happy for the research project to look through the whole policy, we know practically they're not going to read all 10, 12, 15 pages of it. This allows them to pull up all the requirements, filter by which ones apply to a research project, and see, okay, these are the 15 things that I have to care about, which are normally for a research project, things like making sure that they have properly got an agreement with a data provider, making sure that they are following that agreement in how they perform the research, or things that we need for them as a platform provider, like having to tell us when staff members leave in a timely manner. If they have a researcher who has access to the data who leaves their unit, we need to know really quite fast because we need to remove their access because they no longer have the right to access that data. So this is where we try and say everyone needs to play their part in the security. We want to make it as clear as possible what your part is and what requirements that has on you. So in terms of the structure of our information security policy, it has these 5 sections. We start with some context. We then look at what are the assets that we need to manage. How do we do asset identification, asset classification? We look at protection measures. So what are the things we do to protect these assets that we've just identified? We have a section on assessment. How do we look at our performance in implementing this policy? And we have a section on response and recovery. What happens if something goes wrong? What do we do about it? If you look at it in a little bit more detail, you can see that the greatest number of sections are in the protection measures, which is unsurprising. The context is really the background, the stakeholders, our risk-based approach, the kind of the broader parts of what we do with this policy. When we go through understanding which assets are managed, we try and provide a way to think about what are the different asset types. How do we clarify the difference between assets that are administrative, that are around running the system, versus assets that are the actual research data, which we have to protect even more strongly. This is also where we have our asset classification schema. And also we have to think about things like what do we do at the conclusion of projects? What's the situation with data retention? Once a project is concluded, we don't necessarily have the right to keep the data. We have to make sure it goes back to the right place or is deleted. We have a whole bunch of protection measures. I won't go through all of them in detail, but these really cover all of the key things we have to do to protect our data. And this is influenced, in fact, the whole thing is influenced very strongly by not only things like the ISO standards, ISO 27000, but also the CIS controls, which is a big internationally recognized control set for IT services. And we've made sure that we basically cover everything they cover. We have an assessment section. How do we do logging and monitoring? How do we do security review? And then we have the way we respond to incidents. How do we escalate things that are not resolved quickly? How do we deal with risks? How do we deal with exceptions? And how do we deal with disaster management and continuity? In terms of how this policy looks, for each section, there's a couple of parts. So this is, in fact, this very last section under response and recovery, service continuity and disaster management. Just to give you an example, for each section, there is a general description. So this tells you what is this about? What's our general approach? This is more like a guidance rather than requirements. And then there is a list of what are the requirements that we actually have to follow to be safe to follow the policy in this regard. So this is actually quite a simple one for service continuity and disaster management. The first requirement, I don't show all of them, is just that every node has to have its own disaster recovery measures and service continuity measures that they have to document, and these have to be communicated to their customers and users. This is one of those places where we can't tell everyone to do everything exactly the same. Every university has its own way of dealing with fire, flood, earthquake, whatever the big risks are to their continuity. Some have multiple data centers in different locations. Some have highly resilient single sites. We can't make every node host organization change its continuity plans, but we can say that they have to be clear to customers, so customers know if there's a big disaster, what is it that they can expect? What can they rely on? So this is quite a pragmatic approach here. We also have this section on applicability. Who does this particular requirement apply to? This one applies to BioMedIT sites. So this is a requirement on us as the providers of the platform. Others apply to data providers, DP, or research users and projects, RUP. So this is what I mean when I said we can filter the requirements to understand which ones apply to you. We also look at what is the scope of these requirements. Some apply to the platform as a whole, some apply specifically to processing services, some apply really only to repository services. We have both processing and repository services on our platform, so we distinguish here as well. Now, obviously, there's a lot more requirements than this. I just showed one for reference. We make this available, as I'll show you later, to everyone who's a stakeholder within BioMedIT. We do make it available to others on request, but we don't make it public. We try and at least track the spread of our policy, so we're not making it too easy for people to look for security holes. So how do we implement all of this? We implement this through a sort of governance approach within BioMedIT that is between the BioMedIT nodes and the central team provided by SPHN. Our terminology is changing a little bit here, so you'll see DCC, which is a term we don't use so much now, but this is the sort of SPHN central office that coordinates the work across the BioMedIT nodes. We have a group which is the leadership from this central office and all of the nodes who set goals, approve global policies, oversee our progress, resolve disputes. But then they are reported to by our security working group, which includes security officers from all of our nodes and from our central team as well. And we also invite people out from external organizations who have relevant expertise on specific topics. This is where we write the global policies that span across the whole of BioMedIT. We assess technologies, manage global incidents, perform security reviews and audits. And then the implementation work is done by technical teams, both in the central office and in the separate nodes, who implement these global policies. They write the local versions of the policies. They actually implement the technology. They manage the local incidents. This is where the real technical work happens. And as a kind of general approach, we have a trust model where we have really quite high transparency between our partners. We share information, we share plans, models, procedures. We agree to implement these joint policies, and we broadly trust that they are actioned in each of the organizations. But we also do review. So we regularly update our policies. We also do internal assessments of our conformance against the policies, which we discuss and share between the nodes. And this helps us check. I mean, everyone is implementing these policies, but we also have to make sure everyone has the same understanding of them. So we have to do this sort of periodic internal review. And then we have periodic security assessments and penetration testing. We're just at the end of one of those cycles now, where we have external companies to come in and assess our architecture, tools, configuration, and network, try and break into the system and try and look for any gaps that we've left. These always give information. Luckily for us, they've never highlighted anything really bad because we are very careful with our security. But I think we always benefit from these sort of testing periods because there's always something that you can improve. And even if you had a perfect solution last year, the world changes, technology changes, you need to change with it. You always need to have this idea of continuously improving and maintaining your security. And then lastly, in our last couple of minutes, I just wanted to talk about what's the support that we can offer and provide to the people who I assume are attending this event, who are members of our community one way or another, whether they're stakeholders of BioMedIT or they're part of the wider research landscape for sensitive data processing. So at a global level for our community, we manage exceptions and respond to incidents. We provide reusable secure tools for specific topics, particularly things like SET, which is our secure transfer tool, and the BioMedIT portal, which allows you to manage the membership of research projects, give rights to transfer data, monitor and approve and log data transfers, and really acts as a sort of research project management platform for our nodes. This is used for national projects, but increasingly is used by the nodes for local use of their infrastructures as well. And then we provide training and general support for really everyone in the BioMedIT community. This is what we as the security team and the other people involved in BioMedIT can do. Specifically for data providers, which is largely hospitals, but there are other organizations increasingly now there as well. We assist in the safe onboarding of them to our network on a technical level, make sure we have a way to safely transfer data, following our agreements and following legal requirements from their data stores into our infrastructure. We also provide some useful tooling. We have the SPHN connector, which helps them harmonize data internally before it leaves their site into a standard SPHN data format, which again, Sabina is the leader for. We also provide and update the policies so that the data providers can understand how we're looking after their data and they can trust that we're looking after it in the right way and they can see how we improve this over time. And our idea here is to build trust and offer a safe way to increase the impact of the data for the data providers. On the research project side, we assess every research project coming in for its technical security implications. Some are very standardized, others are more specialist or unique and require more work and engagement. But our nodes security officers look at everything coming in to make sure that the projects we're running can be run securely. We also support the creation of the legal agreements between the research projects and the data providers. We offer trusted templates. And overall, we try and support the responsible processing of data in a trusted environment so that the researchers can focus on the things they care about, the research, and trust that we tell them what they need to do to make sure that this is safe, secure, and legal. And if you want to access support, and this is my last slide, for BioMedIT stakeholders, so for the data providers, research projects, etc., we have a private wiki for registered BioMedIT stakeholders, which is where we hold all of the documentation that you need in order to access our system. This also includes a PDF copy of our security policy, but this is only accessible to the nodes, the research projects, and the data providers. If you don't already have access, you can request an account If you go to the website without having an account, you do see a sort of file not found. So contact us and we'll get you set up if you're not already having access to that and you are a BioMedIT stakeholder. For everything else, we now have a really nice new customer support help desk, which is an online portal where we can get your requests, we can get your issues, your technical questions, and triage them and send them to the right person and collect a little bit more data than just sending things through email. And there's a QR code here for accessing that help desk. For the wider community, we would encourage you to use the same help desk. So if you're not already a BioMedIT stakeholder, but you have questions, please get in contact with us, submit a ticket. This includes asking for access to the information security policy. Again, we are happy to share the full policy, but we'd like to know where it's going, and we'd like to make sure people understand that we don't want it made public. So you can have it for your own purposes, but we don't want you to put it anywhere that it suddenly becomes publicly available on, on a doc site somewhere online. And for anything else, you can contact dcc@sib.swiss, which is our sort of general contact email for the central SPHN office that manages BioMedIT. And before we go to any Q&A, and I don't see any questions yet, but I hope you've been saving some, one question that I would certainly like to ask is, what topics would you like detail on in future events? We gave this as a first kind of public webinar on our security approach, both from the legal, the technical, organizational, and policy side. If there are any of these topics you would like a deeper dive into a technical architecture or into the legal issues or the legal agreements, we would really like feedback on what topics you would like us to cover for webinars in the future.